LASIK patient feel at ease? How do I counsel a LASIK patient about what to expect the day of surgery and after the surgery? I work for a group of LASIK surgeons, and one of my job duties there is I am a LASIK counselor. It is my responsibility to share with the patient what to expect the day of surgery and after surgery. It's my job to educate them. Today, I will teach you on what you should tell a patient about the day of surgery and about their aftercare after the surgery to help relieve their anxiety over the surgery. So, first, I'm going to tell you about what to tell a patient to expect the day of surgery. Secondly, I'm going to tell you what to tell a patient to expect about their aftercare. And thirdly, as to what to tell the patient as they are ready and leaving to head for home. I'm going to go ahead and start my PowerPoint presentation. It's on LASIK counseling. So I'm going to talk about the day of surgery. You will be here for an hour and a half from start to finish. You will check in at the designated area to pay for your LASIK surgery. And then a LASIK counselor will take you down to the LASIK center area. At that time, you will be greeted by a friendly and courteous staff member from our laser center. The procedure consent will be explained and it will be signed by you. Then after that, we will offer to give you a Valium. That's where we're going to take away your anxiety. So you'll be prepped for the surgery, and laser staff will explain to you the procedure step by step. You will then be brought into an exam room where you will meet with the surgeon and he will answer all your questions. The surgeon is going to talk to you about 3 essential pieces of equipment that play a big role in your LASIK procedure today. He will talk about the WaveScan, the Vizec Star S4, and the Intralace IFS. The WaveScan has taken mappings of your cornea. That was done on your pre-op exam, and these maps have already been loaded into the laser for your treatment. The Intralace IFS is the laser that will create the flap. That is the time where the patient will feel the most pressure and the most discomfort. So it's very important that they know that going into this procedure. And then the Star S4 Vizec laser is the laser that will reshape the cornea. So then you'll be taken into the laser suite and positioned comfortably on a laser bed. At that time, you'll be covered with a nice warm blanket, and we'll also give you stress balls so that you can hold on to during the procedure. We have hearts for the ladies, and we have basketballs and soccer balls for the manly men. So at that time, the surgeon and the laser center staff will walk you through the procedure step by step. The flap is being made. The Vizec Star 4 laser is reshaping the cornea. By then, all is finished because it takes less than 5 minutes per eye. At that time, we will bring you back out into an exam room where your surgeon will come and go over your aftercare instructions. He's going to talk to you about your mandatory visits. It is mandatory that we see you on a 1-day post-op visit. So we'll see you the next day, either at our office or your referring optometrist will see you. Then you need to be seen at a 1 to 2 week post-op visit, and then a 2 to 3 month post-op visit. And at that time, that is where we begin to talk about a touch-up surgery or second procedure. If you were to need one, we would address that at that time. 5% of our patients do need touch-up procedures. Then you need to be seen for a 6 to 9 month post-op visit and a 1-year visit. After that, the doctor's going to tell you how everything went. Everything went perfectly. Now we wait for your body to do its part. No 2 eyes heal the same, no 2 patients heal the same. The patients are instructed to go home and keep their eyes closed for the first 3 to 4 hours after the procedure. During that time, their eyes are going to burn, they're going to sting, they're going to tear, and they're going to be light sensitive. Their vision's going to be foggy for the rest of the day. And we tell them no rubbing, touching, or squeezing or pressure for 2 months. I think there's a song about rubbing, touching, squeezing. So, all right, so now we're going to talk about your post-operative instructions. What to tell your patients. Your LASIK patients are going to use 2 drops, an antibiotic drop and a steroid drop after the surgery. They're going to use these drops 4 times a day for 4 days and then discontinue. When they start to use them together, they're going to put them in 5 minutes apart so they do not flush out the first drop. They will also be using preservative-free artificial tears for the first 2 to 3 weeks after the surgery to help with dryness. There's also, literally told, no athletic activities for 48 hours, no swimming or water sports for the 2 weeks after the surgery, and no swimming or water sports in a lake for the first month after the surgery. At this time, the patient is starting to become ready to go home. So at that time, if all their questions are answered, we will give them these nice little goggles to wear home. Stylish, all your friends will want them. These are to be put on, and they're to wear these when they sleep at night for the first week so they do not risk injuring the eye at night. After that, we will give the patient the after-hours on-call number so they can call us if they need, and they will also be told that someone will call them and check on them later that night in case they need during the night. And also now the patient is ready to go home, so we will release them to their driver. So in reviewing everything that I've told you today, our practice takes a lot of pride in their patient care. It's with the desire to have excellent patient care that we have happy patients. So having a happy patient makes our day, and having a happy patient makes them willing to share about their experience with us. And by sharing their experience with us, normally brings us referral patients, which helps to grow our practice. So, thank you for allowing me to share today about LASIK counseling. Thank you.
I'm done.